Those living in capital cities across the region say measures have been put in place to fight COVID-19. However, that the levels of measures in place are not uniform. Most of them sent us amateur videos with the situation on ground in different cities, and some say that people are still walking freely. We have cars still moving. This is a big issue. However, we still have many more who are at home, and most even park their cars. Churches and mosques are still operating. Cars are still transporting people as usual, and I wonder to myself, if someone with COVID is among them, how will they survive? We have other places also with many people, like a place known as Kariako. There are too many people in that place. The places that gather a lot of people like buses, markets, bars and nightclubs are still operational. But the measure taken is that they should place water at the side of the roads and the owners of the shops or even stores. So what they do is place buckets of water so people can wash their hands. In Rwanda, measures to combat coronavirus are continuing and many activities are stopped to protect the population against this pandemic. In Kigali, this city had an intense movement of people. Now, everywhere is calm. The specialist in the fight against pandemic pathologies, Dr. Mendes Nkeshimana, indicates that the fight against COVID-19 necessarily requires the collaboration of all countries. When you're fighting a pandemic, there are three things that are necessary. First, the source of the patients, how to stop new infections, and protect those who may have been affected by this pandemic, especially the elderly or those who suffer from other diseases. These measures, however, are not followed in some countries. Everything should be uniform in all countries. They should implement them the same way. If in Rwanda, for example, we keep making the efforts to fight COVID-19 and our neighbors do not do the same thing, I think we would still have a big problem. Statistics from Kenya this Thursday indicated that 234 cases of COVID-19 have been confirmed, including 11 deaths and 53 recoveries. In Tanzania, 94 cases have been confirmed, including 4 deaths and 11 cures. In Uganda, there have been no deaths, but 55 cases have been confirmed, including 12 people who are cured. In Burundi, only 5 cases have been confirmed so far, including 1 death. In Rwanda, 136 cases have been confirmed and 54 people have been declared cured. Given these statistics, the region has 525 confirmed cases of COVID-19. This is in the whole of the East Africa.